Hi everybody, this is another video about mycoplasma. Just before I jump into the video, if you could just take a moment to like or share or subscribe to my content, whatever's appropriate given the medium that you're watching this on, or the platform rather that you're watching this on. I really appreciate it, so thanks for taking a minute to do that. So someone posted a question, someone who used to post questions for me to my on my videos all the time and haven't heard from her in a while, so nice to hear from you again. So I'm going to read the question out because it'll be a little bit easier that way. So it says, I have continually tested high for mycoplasma pneumonia titers over the last 3 years, but I don't have any symptoms of mycoplasma. I know antibodies don't always equate to infection, as it says in quotes, but I feel weird about this, and I'm not really sure if there's something I should be doing about it. The titers didn't change during my Lyme treatment in 2020, 2021. I do have OCD, or I do have OCD since childhood, which I've heard infections can cause, but I don't have other symptoms. Obviously, not looking for medical advice. Thanks for pointing that out, because I, of course, can't give medical advice. And on that note, this video is for informational purposes only. This is not medical advice. If you need medical advice, please talk to your personal healthcare provider. Oh, my computer's saying my battery is going to die, but hopefully it'll make it. So just asking to see if there's a common opinion or something like this on this topic. So thank you for the question. Yeah, it's a great question. Like a lot of the docs out there that I respect the most, that I feel like have some of the best takes or opinions or approaches, that's what I'm looking for, approaches to clinical practice, talk about how it's really important to treat the patient, don't treat the labs. And that kind of works, I guess in a couple of different ways. At the end of the day, if the labs are saying like there's nothing wrong, but the patient's clearly unwell, better treat that patient. But it could work the other way too, where the labs might say, oh, there's something that might be amiss here, but if the patient's feeling good, maybe we don't need to do anything about it, or maybe we do. It's so situation specific. In general, I have had some patients over the course of time where, try as we might, we're not able to completely get their antibody titers, or if we're doing testing through Armin labs, or which is the main lab we use, using ELISpot testing, which is T-cell mediated testing. Sometimes we just can't seem to get them all the way down to a 0, and yet they've clinically improved. They're feeling better. Maybe other things have improved on paper, but like we just can't get them all the way to 100% resolved. And that's something where we just have to make a judgment call. Sometimes talk to the patient, see what they want to do, but rather than like just incessantly treating, if they're feeling good, we just might just let sleeping dogs lie. Mycoplasma is really unique because it is able to go intracellular, and so it is a type of microorganism that might have more of a propensity for just perpetuating antibody response long term. So that might happen, but if the levels are low enough and not causing symptoms, might not be a problem. Things that would spring to my mind would be, could it be that a person who has persisting antibodies might have a biofilm component, and that's where the mycoplasma is hiding out, potentially. Again, if it's not causing problems, maybe it's nothing to worry about. For me personally, if I had a history of chronic infections, of chronic infection with one or more microbes, and I had treated myself, and I hadn't done a thorough biofilm disrupting protocol, and by thorough I mean working with phase 2 biofilm disruptors for a significant amount of time, depends on the case and everything, but for me personally, like I'd probably want to do it for at least 6 months just to be really, really sure that I've kind of tackled everything. I would definitely be thinking about that, so thorough biofilm disruptor for a significant amount of time. And then I'd also be wondering about possible mycoplasma hypersensitivity, where I would personally be treating myself with mycoplasma LDI to that end, although there might be other things that could be used that would be kind of an analogous therapy. So that's kind of what I would be thinking. But I'm a bit of a health perfectionist. Maybe perfectionist isn't the right word, but I'm a health enthusiast. And if I didn't have some other iron in the fire where I was biohacking something on myself, I would probably be doing that, even if I felt really good, just to make sure that I got it all. So those are the things that I'm thinking of. There's actually a second part to this question, more around OCD, but I see the clocks going on there, are like ramping up here in terms of the time for this video. So I'll leave it there for now, and I'll answer the other part ASAP. So thank you for your attention. Thank you for the question. And if anybody has any questions about this topic or anything else, just post in the comment section below, and I'll answer as soon as I can.